call to order this meeting of the Sacramento First Five Commission for Monday, March 1st, 2021. Madam Clerk, will you please call the roll and establish a quorum?
Yes, sir. Chair Sterna.
Here.
Commissioner Sneeringer. Commissioner Fernandez y Garcia.
Here.
Commissioner Gordon.
Here.
Commissioner Casirier.
Here.
Commissioner Wagstaff.
Here.
Commissioner Wirtz.
Here.
Okay, Commissioner Kennedy. Still don't see him unless he's popped into somebody else. Commissioner Hassett.
Here.
Commissioner Turner Johnson.
Here.
Commissioner Evans.
Here.
Commissioner Cossack.
Here.
And Commissioner Moak is out today. So with that, we have a quorum.
Very good. Do you have a image of a flag you can put up?
I sure do. There you are.
All right. If everyone would please rise and join me in the pledge. I pledge allegiance
To
to the flag
the
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I turned off my video because no one needs to see my cargo shorts.
Thank you. Thank you.
All right. Before we get underway, again, I want to welcome everyone that might be viewing today's commission meeting. I do have some rules of engagement I'd like to share. First of all, the rules for commissioners. Commissioners will be unmuted upon entering the Zoom meeting, and I ask that you mute yourself until you are called on to speak. Commissioners are encouraged to make comments and ask questions of staff throughout the meeting. Please use your raise hand button under participants when you would like to speak, and I will call you in order. Please lower your raised hand after you have been called on. Commissioners may see some questions pop up in the Q&A section. Please allow staff to answer those questions as they will primarily be related to making public comment. And speaking of public comment, we have rules for the general public. Members of the public entering the Zoom meeting will have the ability to signal that they would like to make a comment on any agenda item throughout the meeting. To be placed on the speakers list for any item, please click on the Q&A button and write your name and indicate the agenda item you wish to speak on. Please type into the Q&A at the beginning of the meeting or as soon as you know you would like to comment so that staff have time to create the speakers list. We will call your name in the order it was received and unmute you when it's your time to speak. The public calling in through the phone line will also have an opportunity to address the commission. If you have something to say when the phone line is unmuted, please state your name, the agenda item you wish to address, and then your comment. Please comment in the Zoom meeting or over the phone. Public comment in the Zoom meeting or over the phone is limited to 3 minutes so that everyone has an opportunity to address the commission if they so choose. And with that, I believe we're good to go. So first item, please.
Sorry, real quick, I need to read my replay statement.
Of course you do. Yep.
This meeting of the Sacramento Commission is cablecast live on the Metro 14, the Local Government Affairs channel on the Comcast Consolidated Communications and AT&T Uverse cable systems. This meeting is closed captioned and live streamed at metro14live.saccounty.net. Today's meeting will be repeated Saturday, March 6th at 3 p.m. on channel 14. This meeting can also be viewed on Metro Cable's 14 YouTube channel. Thank you.
All right, very good. Okay, so we'll start with our consent matters.
Okay, item number 1, approval of February 1st draft action summary.
All right, does any commissioner wish to suggest any changes? And if not, entertain a motion to approve. And remember to unmute yourself.
Motion to approve.
Okay, we have a motion by Commissioner Wagstaff. Is there a second?
Second.
Second by Commissioner Gordon. Roll call vote, please.
Okay, Chair Cerna,
Aye.
Commissioner Sierringer,
Aye.
Commissioner Fernandez y Garcia,
Aye.
Commissioner Gordon,
Aye.
Commissioner Casirier,
Aye.
Commissioner Wagstaff,
Aye.
Commissioner Wirtz.
Aye.
Great, thank you. Motion passes.
Thank you. Next item, please.
Item number 2, appoint Commissioner Evans to the Systems Optimization and Sustainability Committee.
All right, any comment from commissioners? If none, I would entertain a motion.
I move we appoint Commissioner Evans to the Sustainability Committee.
All right, it's been moved by Commissioner Sneeringer. Is there a second?
Second.
Second by Fernandez y Garcia. Okay, roll call vote, please.
Okay, Chair Cerna,
Aye.
Commissioner Sierringer,
Aye.
Commissioner Fernandez y Garcia,
Aye.
Commissioner Gordon,
Aye.
Commissioner Casirier,
Aye.
Commissioner Wagstaff,
Aye.
and Commissioner Wirtz.
Aye.
Great, thank you. Motion passes.
Congratulations, Commissioner Evans.
Thank you, everyone.
All right, next on our agenda is the public's opportunity to address the commission on items not on the agenda. Madam Clerk, do we have anyone in the queue from the public that wants to address the commission?
We do not have anybody signed up to speak.
All right, very good. Thank you. Next item, please.
Item number 4, Executive Director's Report.
Ms. Galillo.
Good afternoon, commissioners. I have a few things of interest for you today. First, I guess just a touch base about Commissioner Evans is replacing Commissioner Porter on the SOS committee. Commissioner Porter has taken a really huge job as the Director of Child Support Services for LA County. And so just had her last day this past week, I believe, and is starting on March 8th in LA. So we wish her the best of luck. And we're so excited to have Commissioner Evans join us on the committee and lend her expertise. In other news, the last week on Tuesday, the governor signed AB 82, and that allocated more than $400 million to support child care workers in California. It's an urgency bill, which means that it takes effect immediately. And I'm going to ask Commissioner Sneeringer if I can sort of turn it over to her, because she really is the eyes and ears at the Capitol and can better explain what that means for us in Sacramento and across the state.
Sure, I'm happy to. So the $400 million that was part of the early action budget, which was adopted last week, includes, as Julie mentioned, $402 million in federal COVID relief funding. And largely that was split into two buckets of service. One that includes $244 million for pandemic relief stipends to go to child care providers who are providing care for subsidized children. And they will be receiving $525 per child for every child that's served in those programs. And that includes the California State Preschool Program, General Child Care, and the Voucher Service Programs, stages 1, 2, and 3 of CalWORKS, and the AP program. And we anticipate that those dollars should be released sometime in the next couple of weeks. Once the bill was passed, the Department of Education began the process of working with agencies. So they will be working with their state contracted programs and with Child Action to move those dollars out into Sacramento. The other bucket of service is to extend and expand childcare subsidy vouchers for essential workers. I think most of you are aware that there have been several rounds of funding to provide childcare support to essential workers in our community. This allocation includes $76 million to extend those vouchers through June 30th of 2022, and $80 million to add new vouchers through June 30th of 2022. So we are looking forward to seeing direction on those dollars, and I'm sure Child Action is eager to start working with folks to get them enrolled and continued in service. And lastly, there was an addition of 16 paid non-operational days for childcare providers who have a COVID outbreak to be paid during closure. The prior number of days was 14, so they added 16 to that, and we're now up to 40 paid non-operational days. I think any of us who've dealt with a COVID outbreak know that it's longer than a 2-week period. You often have multiple closures happening, especially if you have a center-based program and different classrooms go down at different times. So those are the highlights of the package.
Thanks, Donna, because we kept trying to update that ED report, and then something new would happen the very next day or the very next hour. So we wanted to get you the most up-to-date information. Something else from the state level is that the vape tax has officially been introduced, and this time with First Five receiving 15% of any revenue generated. That's standard right now and how it's working. And when this vape tax was initially introduced last year, it did not have First Five receiving any direct funding. So we're grateful for the updated version. And last week we did reach out to Senator Pan and Assemblymember Cooper to see if they would be potential co-authors for the bill. We're still waiting to hear back, but we were hoping for some local support, and that if this goes through with the 15% backfill, it basically means that we won't see the steeper decline in revenue, which is possible, which was probable from the first time it came around. Other statewide news is that the association is planning its second virtual advocacy day. We try to put the best face on these. It's not as great as gathering at the Capitol with the kids and families, but it works. It gets the job done. We plan to meet with each of our legislators via Zoom instead of in person. And we're going to work with the SOS committee to figure out which commissioners and areas of expertise we really want to join into those virtual Zooms. And then there will also be a Dia de los Libros virtual book read. Last year, it was the first partner reading the census book, and we don't have the details yet, but we'll share the email. We'll email you all a link once we know what's happening on Dia de los Libros, but that's April 30th. And something else that our association is working on is a health plan partnership project. So this is a learning community for the 58 county commissions. We would be paired with commissions who have some of the same geographic managed care plans within those counties. And one of the main reasons for this new partnership is 64% of kids within the state are on geographic managed care Medi-Cal, and or at least get the majority of their care comes through GMC Medi-Cal. And so we really wanted to look at partnerships that the local commissions could make with their GMC providers. And we have pretty good already. We started because of our with First Five Sacramento started with our dental plans. So Access, Liberty, and HealthNet. From there, we built out our partnership with HealthNet so that we now meet with them each month and also discuss the medical side of the house. And we also partner with Aetna. So we still have some room to grow, and I'm really looking forward to learning from other county commissions on how they've built those relationships and how it's either improving access or streamlining services for kids and families. And then just moving more locally, pleased to announce that Lindsay Dunkel was appointed to the Sacramento County, we call it the LPC, the Local Child Care Planning Council. She came on board officially and was immediately elected vice chair at the first meeting. So, but that's really great because it ensures that we then, as a commission, are deeply and meaningfully involved in issues related to early care and education throughout the county. So we're very pleased about that. I have Dr. K here with us today. So I was going to give a brief update on COVID vaccine, but perhaps Dr. K can add to whatever my small update is. One thing at the statewide level is that the governor announced last week that starting in March, the state would set aside 10% of vaccine doses for K-12 educators and childcare workers. In response to that, First Five Association, First Five California, and several other partners sent a letter to the administration regarding the need to utilize the existing collaborative local child care infrastructure. So agencies like Child Action across the state to help with the vaccine outreach and distribution. And then here in Sacramento, Public Health just announced that they're opening vaccines to childcare providers and educators last week. We did create a flyer, which I will share with you, that in partnership with SCOE and with Child Action to promote, and I had it up and everything, and now I don't see it. Okay, I lied. I thought I was going to share it with you, but I don't see it now. So it's in your packet though. So you should be able to see it there. And it's a vaccine flyer that is going out through Child Action to all the licensed childcare providers in the county, talking about the fact that vaccines are safe and effective and are now available. Although we know that we are expecting that there will be some wait time, that there's so many education and childcare providers in the county in this tier that we expect it to take several months in order for all of them to be able to be vaccinated. So we're just saying have patience. I didn't know if Dr. K wanted to add anything to that.
I think that's a very good summary. Maybe just to add that we were notified on the weekend that the Johnson & Johnson vaccine has been approved as well. So that will be good because it will add to the, hopefully to the doses that come to Sacramento County. And I really do appreciate the collaboration that we have with the hospitals as well as with the clinics, and we have a lot of different sites that are providing the vaccine. And actually today we just updated our dashboard to show some of those sites. It doesn't show all of the pop-up sites, but it gives an idea of the number of sites that we have available. And I'm just very appreciative because all of the hospitals are working together. In fact, for many of those sites, you have a combination of staff from each of the main hospital systems that are there to be able to provide vaccine. So we also do have quite a bit more capacity for expansion once we get additional vaccine. So, we'll use it up. Right now, many of the pop-up sites are at school centers because we want to make it more accessible to educators, but I appreciate, Julie, the work that you've been doing with coordinating with the childcare providers, because that group is not as easy to identify as the teachers, because with the teachers, we've been coordinating with Dave. But if there are better ways for us to be able to provide more information and places to provide the clinics, please let us know. We are open to feedback.
Fantastic. We will do that. I feel like we're talking to Child Action and folks on the daily. So if we get any recommendations, we'll send them over to you.
Thank you.
Yeah, you bet. The last thing for the ED report is just that we have the first round of the first 5 California books made it into the hands of the school districts. So all 9 districts now have their packs of, it's a 3-pack of books. So we received 7,000 of those and are slowly making our way out. With another shipment due later this spring, probably in April. That group will go out to the family resource centers and through pediatric clinics with the help of Commissioner Fernandez y Garcia. That concludes my director's report.
Very good. Thank you. Any questions for Julie? All right, hearing none. Thanks again, Julie, for that report. So now we will move on to the advisory committee update.
And I'll give that too because Bob wasn't able to join us today. So very briefly, we met on the 5th. We made some new appointments. The chair appointed 2 members of the advisory committee to each of our standing commission subcommittees. So for evaluation committee, Robin Blanks-Guster and Emily Bowen will be serving on that committee for the year. In financial planning committee, Walter Winarchik and Sylvia Rodriguez. And then in our SOS committee, Alexandria Page and Pooja Mittal will be serving on SOS. So we have some fresh faces and new ideas coming into the committees. We're excited about that. I just gave a brief update on the governor's proposed budget, the COVID-19 vaccine efforts for childcare workers and some of the essential supply stuff. So some of the same things y'all just heard. We asked members to review and provide input to us on the resolution that was recently approved on racial equity and social justice. We discussed the role of the advisory committee in helping us to create the never say that word. Yeah, I can't even go there, sorry. Operationalize, that's it. Operationalize the plan to actually start implementing those goals that we had in the resolution. So they had some great ideas. They definitely want to be involved. And so we look forward to helping, getting their help as we do that. And then finally, they received the same presentation that you all received last month on the 2019-20 evaluation findings. And that's what we did.
All right, very good. Thank you. Any questions about the advisory committee? All right, next is the evaluation committee update.
Yes, we did not hold a meeting since the January 14th one. Our next meeting is planned for March 15th. And as always, we appreciate both the commissioners and advisory committee members' valuable input into that process.
All right, very good. Thank you. And financial planning committee.
Again, we did not meet since our last meeting, so we have nothing to report at this time.
All right, thank you. Next, we have the Systems Optimization and Sustainability Committee update.
The longest committee name ever. So we did meet on the 19th of February, and we had a discussion about current budget and policy proposals, that would impact our programs, and worked on the 2021 policy priorities for the commission, which you'll be voting on later in this meeting. We also did discuss the operationalizing of the resolution on equity and social justice, and had some time to talk about the evaluation plan for sustainability and the certified sustainable wrap-up. So we had a robust discussion, and you'll be voting on part of what we worked on later in the meeting.
All right, thank you, Don. Okay, next item, please.
Item number 9 is the approval of funding recommendations for programs under the result area of infant death and empowered families.
And Latina Price, staff person, really coordinated most of this item, and we'll be presenting it to you today for your approval. And we do have some speakers eventually who you'll hear from as well.
All right, thank you, Julie. Hello, everyone. Good afternoon, commissioners. This item we have before you today represents our second round of funding recommendations. And if approved, the commission will award contracts to partners for fiscal year 2021-24 strategic plan. The specific result areas in this item are for services to improve perinatal conditions and decrease infant death, and also to increase use of effective parenting to decrease child trauma and maltreatment. Each of the proposals were submitted in response to a competitive RFP process and underwent a multi-step review process. That review process included a review of audits and other financial information to check for fiscal solvency of the agencies. It included an internal review by staff to ensure that it met the requirements and the intentions of the RFP, and that they supported the strategies outlined in the implementation plan. And finally, each proposal underwent a review by an external review team that consisted of advisory committee members, content experts, and folks from our community connections grants. After proposals were scored, review teams met to discuss the challenges and the strengths of the proposals and also any concerns. We then finalized the scores, and funding recommendations were posted to our website online, and letters were also emailed to each of the proposers. The top scoring proposals are being recommended for funding, except for in the case of the Empowered Families African American Focused RFP. The top scoring applicant did not request all of the funding, so funding allowed for the top 2 proposals to be recommended. No letters of protest were received from any of the proposals. In your packet, you will find a synopsis of each of the proposals and programs recommended for funding. They were included as attachments 1, 2, and 3. Each synopsis you'll see outlines the key services and strategies included in each of the proposals. Today, we are asking for your approval to enter into contract negotiations with each of the 4 proposers to finalize the scope of work and the budgets associated with that. So with that said, staff are recommending that the commission approve this funding recommendation, which would result in an award to the following agencies: the Center for Community Health and Wellbeing, Her Health First, for the amount of $2,400,000 to provide community-based peer education, support services, and other assistance to African American women during pregnancy and postpartum. Funding for the Child Abuse Prevention Council of Sacramento and the Birth and Beyond Collaborative for a total of $13,332,333 to provide family support services, including home visitation, parenting education, crisis, and social supports. Lastly, funding for Mutual Assistance Network for $1,320,000 and for Sacramento Children's Home for $930,000. This is also to provide family support services, but specifically targeting African American families in outreach and service provision. These amounts are included in our approved spending plan for the new strategic plan for each of the 3 fiscal years. We are happy to answer any questions you might have about the contracts or about our process. Thank you.
Thank you, Latina. Good report. Anyone have questions for staff?
Yes, sir.
Yeah, Mr. Wagstaff.
Just if you could, just remind us, I didn't see it in the material, what kind of report back, what kind of data and ongoing reporting will the commission get from these organizations?
Primarily, the commission receives an annual report update of the outcomes and services by our funded partners. The evaluation committee may have more contact with those numbers, but staff receive quarterly reports based on milestones that are drafted based on the scope of work of the services they're providing. So we look at those quarterly.
And then the commission gets an annual report?
Yes.
Thank you.
Commissioner Cernick, could I add another point on that?
Yes, please.
Each of those providers, I think, and there may be specifics here, but each of them also introduce data into the data collection system on a routine basis, and that is monitored on an ongoing basis that we hear about from staff doing the monitoring that we follow on the evaluation committee as well. So I would say there's a lot of work goes on in the meantime about making sure that data is being entered in a timely manner and in a complete manner. So I just want to highlight that staff does a lot of work throughout the year to monitor that process.
Thank you.
And may I add just one more piece too, which is that several years ago, we went to something that we call results-based accountability. So the types of information, the types of data that we receive, we look at how much did an agency do, how well did they do it, and then is anybody better off? So we can kind of across those three areas, we develop an evaluation plan as part of our contract negotiations. And that plan becomes a piece of their actual contract with the deliverables laid out as to what the expectations are. So then we track that through the RBA throughout the year.
Thank you.
Any other questions for staff? If not, Madam Clerk, do we have speakers on this item?
We do have 4 speakers. We will start with Shannon Shaw.
Okay. Oh, you're muted, Shannon.
I think that maybe I'll get the hang of it someday. We'll see. Anyhow, Shannon Shaw with Her Health First and home of the Black Mothers United program. I just wanted to take an opportunity to say thank you to the First Five Commission, First Five staff for remaining steadfast in your commitment to the reduction of the disproportionate African American infant death rate. The importance of your leadership cannot be overstated, especially given that more often than not, funding and focus tend to change. Our partnership with First Five Sacramento over the past 7 years has enabled our agency to deepen our longstanding relationship with families in Sacramento's Black community. And there is truly no greater privilege than the opportunity to embrace our moms and support their families during the fragile miracle of pregnancy and birth. We look forward to the anticipated approval of the funding recommendation and to continuing our work of advancing health equity and improving birth outcomes in our community. Thank you so much.
Thank you, Shannon.
Thank you. Next, we have Sheila Boxley.
Good afternoon, commissioners. I am here representing the whole collaborative, the Birth Beyond Collaborative, and we are very pleased about the recommendation for funding. And I want to point out that while it's one contract that goes through the Child Abuse Prevention Council, it is indeed the funding for all 9 family resource centers. So it really covers a great deal of geographic territory and many people. It has been a long, successful partnership with First Five, and we appreciate that recommendation for ongoing funding. It is really critical to maintain the infrastructure of the family resource centers. They really are the scaffolding in Sacramento County for primary prevention activities. And so we appreciate it and we second the recommendation. Thank you very much.
Thank you, Sheila.
Next, we have Robert Sanger.
Good afternoon, everyone. Can everyone hear me?
Yes.
Yes.
Okay, perfect. So my name is Robert Sanger. I'm the executive director for the Folsom Cordova Community Partnership. We operate one of the Birth and Beyond Family Resource Centers, and I'm the chair of the Birth and Beyond Collaborative at this time. I wanted to take the opportunity to thank the First Five Commission and staff for their recommendation and consideration of the Birth and Beyond program for the Empowering Families area of their strategic plan. As you know, Birth and Beyond operates 5 family resource centers in Sacramento County. I wanted to share with you that during the COVID-19 pandemic, the Birth and Beyond Family Resource Centers were flexible, creating opportunities for innovation and continuing our engagement with the families that we serve. The Family Resource Centers immediately started virtual home visits and parent education workshops, pivoted to offer engagement activities like drive-through events when county and state requirements allowed for that to happen, as well as leverage Birth and Beyond Family Resource Centers as trusted locations to bring resources such as COVID-19 testing, concrete supports for families impacted by the pandemic, and some of the FRCs are even ready to offer their sites as pop-up vaccine clinics. Your support in the next First Five strategic plan period will allow Birth and Beyond to continue these types of vital resources in Sacramento County and prepare for any future needs that our communities have. And I appreciate and thank you for your recommendation and consideration.
Thank you, Robert.
And next up is Danielle Lawrence.
Thank you. Good afternoon, Chair Cerna, commissioners, and the First Five Sacramento team. My name is Danielle Lawrence. I'm the executive director of Mutual Assistance Network. And I just want to express gratitude and thanks for your consideration of approval to fund the work we are doing in Arden Arcade. I also want to extend many thanks to Executive Director Julie Galelo and Program Planner Latina Price for their support and overall commitment to cultural responsiveness and racial equity in funding. The MAN team is dedicated and intentional about our work within the neighborhood and with the residents. We commit to continuing this great work and build upon the success already attained in the next 3-year cycle. Much appreciation. Thank you.
Thank you, Danielle.
Thank you. And we have one other speaker. I apologize if I mispronounce your name. Sharuk.
Hi, good afternoon, everyone. My name is Sharuk Chishti. I am from Sacramento Children's Home, and I just wanted to share on behalf of our entire team our thanks and gratitude towards the recommendation. We work with our African American community within called our Village program through our Valley High site, Family Resource Center, and it's just an honor to be part of this larger collaboration and working directly with Danielle and her wonderful team. So thank you so much for the opportunity.
Thank you, Sharuk. Okay, do we have any more speakers?
No, we don't.
Okay, very good. Any comments or questions from commissioners? Not, I'd like to entertain a motion.
I move approval of the funding recommendations for programs under the results of infant death and empowered families.
Okay.
I'll second.
Okay, so it's been moved by Commissioner Sneeringer, seconded by Commissioner Wagstaff. Madam Clerk, will you please call the roll?
Sure will. Chair Cerna.
Aye.
Commissioner Sneeringer.
Aye.
Commissioner Fernandez y Garcia.
Aye.
Commissioner Gordon.
Aye.
Commissioner Casirier.
Aye.
Commissioner Wagstaff.
Aye.
And Commissioner Wirtz.
Aye.
Thank you. Motion passes.
Good. Thank you. Next item, please.
Okay, item number 10 is the approval of funding recommendations for a data management system.
All right, and Carmen Garcia Gomez is going to take this one for the staff.
Good afternoon, commissioners. My name is Carmen Garcia Gomez, and I oversee evaluation. Today, I come to you for the approval of funding recommendation for a data management system. We'd like you to authorize the executive director or her designee to negotiate and execute an agreement with Persimmon International, Inc. to provide a data management system for the contract term of July 1st, 2021 through June 30th, 2022. For the amount of $68,700 with an option of 2 annual extensions through June 30th, 2024. If extended beyond June 30th, 2022, the maximum payment amount for the 3-year period is $206,100. The Children and Families Act of 1998 requires that California's 58 county commissions submit an annual report to the first 5 California State Commission by November 1st of each year. The State Commission complies and analyzes the data for each county for inclusion in the first 5 California State Annual Report to the legislature. A data management system is necessary for First 5 Sacramento to collect not only the demographic data on the clients that are served as required by the State Commission, but also to track and report out on contractor milestones, result area outcomes, and accomplishments. We also come to you on an annual basis to present our annual report, First 5's annual report, something that we are very proud of. A competitive bid process to select a system was implemented with a request for proposal for data management system that we released in November. We received a total of 6 proposals by the deadline, and they all included the elements per the RFP. We had a very extensive review process, which included an internal review of just making sure that all of the required documents were submitted on time. Then we had an external review that included members of our advisory committee as well as community experts. The reviewers utilized a detailed tool and scoring rubric that mirrored the core requirements of the proposal. The reviewers were given the opportunity to change the scores based on the discussion once we came back together for the review process. The proposals that received the top 3 highest scores were then invited to participate in an interview and to provide a demo of their system to the review panel members. We also conducted reference checks on the top 3 proposals. Between all 3 steps in the process, proposals could receive up to 160 points. The proposal with the highest scores is being recommended for funding. The funding recommendations were posted on our website, as well as each one of the proposers received letters. As you can see here, it was a very competitive process, and the vendors scored similarly in range of 140 to 146 points. I told the staff and my boss, Julie, that this was probably one of the hardest decisions and jobs that I've ever done in my time with First 5 Sacramento. Staff are recommending the continuation of Persimmon system to provide a cloud-based data management system for unlimited users, storage, maintenance, technical assistance, and support, as well as a project manager and database developer to enhance the current platform. We're asking the Commission's approval of the recommendation awards Persimmon International, Inc., up to $206,100 to continue to provide data management services to the Commission and its funded partners. This amount is included in the approved spending plan and will be incorporated into the budgets for fiscal years 2021 through 2024. And that concludes my report.
Very good. Thank you, Carmen. Any questions of staff?
And representatives from Persimmon are here. Let me move them over in case you have any questions or they would like to address the Commission.
Mr. Chairman, if I might,
Sure.
You know, Carmen, it was very tight. Can you just say in a nutshell, what swayed you between the 2 top leading proposals? I mean, there's only a 1-point difference. Can you just highlight for us what the key thing was that generated the recommendation?
The key decision, and I just want to say that I had no part in scoring these proposals because I feel working so closely with Persimmon for the past number of years, and just being so involved in evaluation, I did not want to bring any bias. But I did do the reference checks and facilitated the review process. And the final decision, the reason we selected Persimmon was because we will be getting unlimited users, storage, technical assistance, a project manager, and database developer. That's something that the other proposals did not include on an unlimited basis. And with First Five Sacramento, I'm the person in charge of evaluation and overseeing the data management system. And speaking to other First Fives, they had multiple staff working on evaluation and overseeing data management. And so I really wanted to make sure that we had a system and that came with support staff.
Did this receive any protests?
No.
Thank you.
Okay, any other questions for staff?
Commissioner Cerna, I'm not sure if you see my hand up, but
yeah, Commissioner Wirtz, go ahead.
Thank you. I was also curious about the closeness of that, and obviously in terms of the overall view, those are all sound like they were credible proposals that may well work well for us as a commission. So that was good to see that we can get other alternatives. I also like the fact that you're choosing to fund only the first year of this at this point, with the potential for funding the future years. And I think that assures us that Persimmon, who has been doing a good job, but there remain challenges, of course, will be able to work during this first year with Carmen to ensure that the kind of improvements in the platform that we're looking for will likely be given the attention they need to if they want to continue to get the follow-up years of funding for this. So I was pleased with both the process as I've learned about it, and with this decision to essentially be somewhat cautiously moving forward with Persimmonities to ensure that First Five gets the full data management needs that it needs over time. So I was very pleased to see this process and with the way that it's been handled here. So very supportive.
Thank you, Commissioner Wirtz. Mr. Kogas, did you want to share anything with the commission?
I just would like to thank you opportunity to work with Commission. We've been working with you for over a decade, so this is absolutely exciting opportunity to continue to manage this immense wealth of data and being able, of course, based on your feedback, improve. And again, as Carmen mentioned, we provide unlimited customization, unlimited development. And the feedback, by the way, lately from First Five Commission, specifically from Carmen, was absolutely magnificent. New development was done, which is actually being used in other commissions because of something that was spearheaded by your commission. That was very exciting. So we're looking forward to build even tighter partnership with you.
Very good, thank you. Okay, any other speakers, Carmen?
No, we do not have any other speakers.
All right, if there's no further questions or comments by commissioners, I'd entertain a motion.
I so move.
Okay, it's been moved by Commissioner Wirtz.
I'll second.
I'm sorry, who seconded? Oh, Commissioner Gordon?
Dave Gordon.
All right, second by Commissioner Gordon. Roll call vote, please.
Chair Cerna.
Aye.
Commissioner Stehringer.
Aye.
Commissioner Fernandez E. Garcia.
Aye.
Commissioner Gordon.
Aye.
Commissioner Casirier.
Aye.
Commissioner Wagstaff.
Aye.
Commissioner Wirtz.
Aye.
Great, thank you. Motion passes.
All right, thank you very much. Okay, next item, please.
Next item, item number 11, approval of First Five Sacramento 2021 policy priorities.
Great. And Erin is going to take this. She handles all of the policy work for the commission.
Good afternoon, Chair Cerna and Commissioners. Today we are here seeking your approval of the 2021 First 5 Sacramento Policy Priorities. Back in 2016 is when we created these priorities with the Systems Optimization and Sustainability SOS Committee, previously named the Sustainability Committee. The First 5 Sacramento advocacy efforts in 2021 will continue to focus on our key areas of health, early care and development, empowered families, and systems change and sustainability. The SOS Committee met on the 19th and is recommending commission approval of the policy priorities. The number of priorities increased from 10 to 13. 3 new priority areas were added to the systems change and sustainability section to address the following topics: the resolution on equity and social justice, the home visiting collaboration, and the pandemic's impact on family. And you can refer to page 38 in your attachment for the specific changes in red and blue. And please note that these priorities also align with the efforts of the First 5 Association and First 5 California. So in conclusion, we seek the approval of the commission. Thank you.
Thank you, Erin. Okay, any questions for staff? All right, seeing none.
I didn't have questions so much as just a brief comment. Oh, Dr. Kasiri, I'm sorry. TikTok.
Dr. K, you're muted. There you go.
Oh, I was going to say you go first since you started talking, but. Oh, okay.
Go ahead, please, Dr. Kasiri. Go ahead. I'll follow you.
Just a very brief comment. I just wanted to say thank you for including mental health. I do see that as one of the priorities. Now I've lost where it was.
Number one.
Number one, of course. Yeah. So yeah, just wanted to thank you for including that, because I think over time we've recognized how more and more important mental health is and how it actually impacts a person's overall health.
Comment. Thank you. Commissioner Gordon?
That's exactly the comment I was going to make, was to express appreciation to how that need threads through 4 or 5 of the other priorities as well. So thank you for including that. And with that, I'm happy to move approval of the item.
Okay, we have a motion by Commissioner Gordon for approval. Is there a second by Commissioner Sneeringer? Roll call vote, please.
Sorry. Chair Cerna.
Aye.
Commissioner Sneeringer.
Aye.
Commissioner Fernandez y Garcia.
Aye.
Commissioner Gordon.
Aye.
Commissioner Kasiri.
Aye.
Commissioner Wagstaff.
Aye.
And Commissioner Wirtz.
Aye.
Thank you. Motion passes.
Very good. Thank you. Next item, please.
Next item, item number 12, public hearing, annual review of First 5 Sacramento 2021 to 2024 strategic plan.
Okay, I got this one. So each year the commission reviews and holds a public hearing on its strategic plan. And this will be the first review of our plan that hasn't even started yet, but we'll begin on July 1st. This is the 2021 to 2024 strategic plan. You'll remember back in May, we approved the plan, and then in August, we approved the more detail of that plan in the implementation plan. And then, of course, during the fall, we did release our RFPs and are now making those awards and getting ourselves ready to begin implementing the plan come July. We are recommending that there are no changes to the current strategic plan. And I'm just going to throw this up on your screen really quick. These are the areas of the plan, the priority areas, our 3 goals, and then our 7 result areas. As a reminder, 2 of them are areas that are just systems results, and then there are 5 that are a combination of systems as well as direct services. And so staff are not recommending any changes at this time. However, holding the public hearing today will meet our requirement and keep us in line with the statute. So we ask that you do that.
All right, thank you very much. And with that, I'll go ahead and formally open the public hearing and ask our clerk if we have anyone who is in the queue to address the commission.
We do not have anybody signed up to speak on this item.
Okay, I will close the public hearing. My understanding, Julie, is that we don't have to vote on anything, correct? We're just receiving this.
You don't, you just have to, yeah, exactly.
Any questions by commissioners? Okay, all right, thank you. All right, and our last item, comments by commissioners. I have a comment and I don't see that she's on the call any longer. Maybe she is, but today.
She can hear you, Phil. She just can't see you. You can't see her, but she can see you.
Okay, I just wanted to acknowledge that today is Linda Fonkstamera's birthday. So wanted to wish her a happy birthday from all of us. And again, thank her for all of her great work.
Mr. Chairman.
There she is.
Thank you.
Happy birthday. I also
Happy birthday.
Birthday.
I'm sorry, go ahead.
Happy birthday.
Thank you so much, everyone. Have a great day.
Thanks.
Mr. Chairman, just briefly, just wanted to note that I'm working with Julie to make a recommendation with respect to Terry Porter's alternate seat. Terry, as Julie mentioned earlier in the meeting, was very successful in becoming the new director of child support down in LA County. We're very happy for her. And so we'll be moving forward to make that recommendation.
Very good. Any other comments?
I should just wanted to add that I immediately got her in touch with Kim Belche, who is the executive director of First
Right.
LA. They're talking now, and commission where she would be amazing there as well. So wish her luck on that.
Good. Okay, any other comments by commissioners? All right. Well, I want to thank everyone again for attending today's meeting and for those members of the public that took the time to address the commission. If there's no further business before us, I declare this meeting adjourned.
Thank you, everyone.
Thank you all.
Have a wonderful day. See you in May.